With us today, talking about acne, eczema, and psoriasis and natural approaches to them, we have Dr. DeJarra Sims. Dr. Sims is a published author and licensed naturopathic doctor in the state of California. She currently practices at Nourish Medical Center in San Diego, where her primary focus is the treatment of skin diseases, hair loss, and digestive disorders. Dr. Sims received her bachelor's degree in biology and her ND degree from the Southwest College of Naturopathic Medicine. She has also served as an assistant professor and faculty at Bastyr University in California. I think her personal motto is to inspire women to find their voice and their inner beauty and challenging their health from the inside out. So we're really excited to have Dr. Sims with us today. Before I get started, if you can just go to the next slide, all attendees are in listen only mode. And if you do have questions during the course of the day, I see somebody put something in the chat. Please use the question and answer button for questions during the course of today so that I can track it a little bit easier. We are recording this and we will share this link when it is ready. And if you have any additional questions or concerns, always email us at info@aanmc.org. And so with that, I am going to make my face go away and turn it over to Dr. Sims. So thank you all for coming, and thank you, Dr. Sims, for presentation today.
Thank you so much for having me, Doctor. So let's get started. I'm going to try to move. Let's see. So just kind of letting you know a little bit about who I am. I am Dr. DeJarra K. Sims, but my patients call me Dr. DJ. And I went to Prairie View A&M University. So we did talk about that in my bio. So I'm not going to talk too much about that, but I love Prairie View, and it's in Texas, a little small little town outside of Houston. I am from Texas, but I was born in Alabama, so I'm double country. So you'll hear a little Southern accent come out. I've squashed most of it, but it comes out when I say things like ice and miles and July. But I also went to medical school in Southwest College of Naturopathic Medicine in Phoenix, Arizona, which I love, but it's very, very hot there. And I chose it for that reason, because at the time there were only 7 naturopathic schools, and the other 6 were in very cold places too in Canada. So I was like, let's go where there's heat, because I'm from the South and I will not survive in the snow. Extracurricular activities, things I like to do. So I am big into improv comedy. So I do improvise on a team. I have shows every other week at Find a City Improv here in San Diego. I also trained at the Second City in LA, in Hollywood. And I trained in comedy writing and stand-up and improvisational comedy. So that's what I like to do. So I try to spice things up, and I'll keep it fun for you guys, and hopefully you'll enjoy this presentation. So one of the first things I want to talk about is our agenda, because I like to have, a flow of what we're doing so you understand where we're going. So we're going to talk about some learning objectives. We're going to define acne, eczema, and psoriasis. Then we're going to discover the root causes of acne, eczema, and psoriasis. I'll talk about the naturopathic approaches, and then we're going to do a patient case, and then I'll open it up for questions. So just put your questions, like Dr. Yana says, in the question area, and then she'll answer those questions. We'll answer them at the end, okay? So learning objectives. By the end of this lecture, and I have to do it like this because I'm a professor, by the end of this lecture, you're going to be able to identify hallmark features of acne, eczema, and psoriasis, be able to understand what causes acne, eczema, and psoriasis, understand the naturopathic approaches to skin diseases, and we're going to review some of the common naturopathic treatments of acne, eczema, and psoriasis. Now, I'm going to say this, I am a doctor, but I am not your doctor. So what I am going to give you are an overview of some of the things that are very common to use as treatments that most people can use without any type of interaction with medications. They are not the end all and be all of my treatment, but I want to hit some of the high points so you understand like how we treat it, because I really want you to get an understanding of what makes naturopathic medicine different from other forms of medicine. Okay, I don't know why this bar won't go away. Let me see if I can get this out the way. Hide video panel, boom. Okay, so acne, eczema, and psoriasis. First of all, acne begins with a clogged pore. We talk about it being a clogged pore, correct? Well, This is called the pilosebaceous unit. So the pilosebaceous unit, pilo meaning hair, sebaceous meaning sweat, is that unit that actually gets inflamed and causes acne. And so when that's inflamed, we get acne on the face, neck, upper trunk, upper arms, where the pilosebaceous unit is, right? And in eczema, this is an atopic dermatitis, so usually caused by some type of allergic reaction from a naturopathic point of view. And we're going to talk a little bit about that later. But it causes itchy skin plus three or more of the following: history of involvement of skin creases, history of asthma or hay fever, history of generally dry skin in the past year, onset under 2 years old, and visible rash on the flexures. Now, this they have to have three of the following, right? So it's not just itchy skin, it has to be some of the other ones, and that's kind of how we diagnose eczema. Now, when we look at psoriasis, this is a common inflammatory disease of the skin, but it's immune mediated. And it's going to manifest as skin that is scaly and dry, and they're like what we call plaques. So it's going to look like a circle, usually in most cases. Now, there's different types. Psoriasis, we have plaque psoriasis, which is the 80% of most psoriasis. So we're going to limit our talk to that. Then we have inverse flexure, guttate, erythrodermic, and pustular psoriasis. So we have these several different types of psoriasis. Same with eczema. There's several different types of atopic dermatitis. And acne actually comes in several different types. But we're going to talk about these as broad categories because what you'll see is that in naturopathic medicine, we actually treat them very similarly. So we're going to talk about how we treat them the same and still be individualized in our care. So here's just a photo of it. Now I had a bunch of photos, but some of them didn't come through, but these are the main ones that I wanted to show you. So acne, if you look at this, it has these white heads and black heads, what we call, comedones, open and closed comedones. That's the medical term for it, but we call them blackheads and whiteheads. And then eczema, the main presentation of eczema in adults is on the hands, but in children's, it's in the flexures. So like the creases and inside the inner elbows, inner knees, right? That's where we see it in kids, but in adults, the major presentation is in the hands. So you start seeing hand rashes, think eczema for adults. And then when you look at psoriasis, that's that silvery plaque I was talking about. We see it in the scalp, we see it all over the body, but they tend to flake a lot. And so what you notice, the hallmark of all of these diseases is this skin being like a part of this mental health picture, right? Because it's not just that you have a disease process going on, but unlike other diseases with the skin, people see it. And so there's a mental health component to it that not only is debilitating for patients, but it also increases inflammation, because when you start having a visceral response, like a mental response, you actually can increase cortisol, which causes the skin to be more inflamed. So they're caught in a cycle of inflammation. And so when we talk about how we treat skin, we can't just talk about here are the supplements, take this herb. We have to have a mind, body, spirit approach. And that's what I love about naturopathic medicine. So one of the things that I love to say is like, discover your skin villains. And this came about because with me, I have created a website called Superhero Skincare, and that is my brand. And it's at superheroskincare.com, where you can see all of my programs, but we talk about discovering your skin villains. And the reason we talk about discovering your skin villains is because there are several different things that cause skin disorders, acne, eczema, psoriasis included, but also rare skin diseases. And you can really boil them down to being caused by either liver congestion, impaired digestion, nutrition, hygiene, hormone imbalance, or environmental toxins. Now, it could be one of these, or it could be a combination of these. But what you'll see is that these are the villains of our skin. And so that's my little like cartoon of me, on a good day when my makeup is popping. That's how I look. So, so what we're going to do is we're going to break down what it looks like so that as a naturopathic doctor, you see, because this whole thing is kind of giving you like a bird's eye view of how I approach skin diseases and how we approach them in naturopathic health. And so I want to give you an understanding of what I'm looking for in a patient. Did I mute? Okay. Joanne, did you hear everything I said, or did I mute myself?
I can hear you fine.
Okay, perfect. I had just muted it for some reason. Okay, but
Okay.
I got it. I caught it before I got to the next slide. Perfect. Next slide. Okay, so liver congestion, and we're back. So liver congestion. So what you're going to see with liver congestion is a history of rashes. So what I'm looking for in the intake, right? So this is, we come in, we see a patient sitting before us, and we say, okay, what is wrong with this person? They have acne, they have eczema, they have psoriasis. General doctors say, oh, you have eczema, give you a steroid. You have psoriasis, give you some biologics. You have acne, get some of this Accutane. But my approach is different. So what I'm going to say is, do you have a history of rashes, itchy skin? I'm listening for this. Hemorrhoids, stress, irregular sleep, hair loss, fatigue, irritability. When I see these in the intake, then I'm like, wait, liver's congested. So what does stress look like for them? So some people might not come in and say, oh, I'm stressed out. They're not going to say that. They're going to talk about all their excessive commitments. They're going to talk about they have emotional instability. Like, my mood is so changeable. They have adrenal fatigue. They might have heard that on Instagram and they use that. They might have canker sores, herpes sores that are flaring all of a sudden because those flare in stress. Stomach ulcers or pain that they hadn't had in a long time, and all of a sudden they get this stomach ulcer or they have pain. And that is a sign to me, flares of any of their chronic diseases that have been calm. That's a sign to me that they're overstressed, and that stress can cause liver congestion. And so we start to look at, what does this patient look like physically in front of me? And then we take those symptoms and we figure out which skin villain is causing the problem. So impaired digestion, what do I hear the patient say with impaired digestion? There's constipation, there's diarrhea. They say they've been diagnosed with IBS-C or D, meaning irritable bowel syndrome, constipation, irritable bowel syndrome, diarrhea, right, as the main symptom. Undigested food and stool, blood and stool, or history of wiping blood. I will tell you that 99% of the patients that come to see me with acne or eczema and psoriasis, 99% of them have constipation or some form of digestive disorder. The 1% that don't have constipation, it's because they fixed it right before they came to see me. But generally, all of them have some form of impaired digestion. History of antibiotic use is something we see. Symptoms of excess hormones, meaning they've been on steroids for some reason, or they were using birth control. They have what is termed now leaky gut or intestinal hyperpermeability. Dysbiosis, meaning an excess of some bug in their stool, whether it's a good bug or a bad bug is yet to be determined. We have tests for that, but we need to see if there's dysbiosis. SIBO, small intestinal bowel overgrowth, that's also some bad bug in the wrong place, overgrowing itself. And then once again, that intestinal hyperpermeability is another word for leaky gut. So these are the things that we see with impaired digestion. When they have impaired nutrition, lack of proper skin nutrients. I say this all the time to my patients. You can't make healthy skin if you don't have the nutrients that you need to make good skin, right? So if you're not eating vegetables, you're not going to have healthy skin. If you're not drinking water, you're not going to have healthy skin. So if you have increased sugar intake, you're going to have more inflammation. Insulin resistance with increased skin tags lets us know that there's some impaired nutrition. Increase of food sensitivities. Like all of a sudden, when patients come in with eczema, they'll say, hey, I used to be able to eat anything I wanted, but all of a sudden over the past 2 years, I can't eat pineapples, I can't eat oranges, I can't eat berries. Now I can't eat this food and that food and this food and that food. And I've actually had a patient come in that have been limited to 7 foods that they can eat without having a skin flare of eczema. Another patient could not eat anything but 3 foods without having a flare of eczema. And it breaks my heart because can you imagine only being able to eat 3 things every day for years, because if you ate anything else, your skin would flare. The digestive health and nutrition are so important in treating skin diseases, and that is the key to treating all skin diseases is to treat the digestion. So what I'm going to talk about later is how we do that. But we also see a history of food allergies, which is different from a food sensitivity. And we'll talk a little bit about that later also. And then increased alcohol intake. So I always see flares in my college students, my new college students, because they're like, turned up, just got to college, I'm going to drink, I'm going to drink. And then all of a sudden, the eczema they haven't had since they were 2 flares because of the excessive alcohol intake that then impairs digestion. It's impairing their nutrition and additionally congesting their liver. So then you have 3 skin villains you have to deal with. And what I have to do is figure out which of the skin villain is the big baddie and which one to start with first, because we have to address all of them. But which one are we going to start with first? That's the key. Okay. Increased drug use is also a situation that we see. And just, a side note, how I decided to even focus on skin is that after graduating SCNM, I was working half the time in a drug rehab. And on the weekends, I would see patients come in and they would either spend 30, 60, or 90 days. They were detoxing from alcohol, heroin, cocaine, methamphetamines. All of these things were with methamphetamines. They would have, with meth, they would have the skin. You've seen those pictures before and after people using meth. They would have the meth skin. And then people that had track marks on their arm, lots of scarring from using needles and injecting drugs. And so over 30, 60, and 90 days, after putting them on detox protocols to help heal their liver and support their nutrition and heal their gut, we would see all of their skin clear. So when the case that you'll see later with me, the cases of the first acne patient I ever had where I implemented the detox protocols that we have in the drug detox program. And we used that because I saw the skin clear and I said, what if I use those in addition to some other skin things I know and help this patient with cystic acne? What would happen? Will her skin clear in 30, 60, or 90 days? And that's what I saw. And that's what happened. So I'm going to share that with you later. Hygiene. The big thing on hygiene is this is the first thing most people try to fix. They go, okay, I'm going to fix my skin, so I'm going to get super clean. And then they do a lot of face washing with harsh chemicals, or they do all of these things that they see on TikTok and Instagram. And their hygiene is better, but it sometimes can be like the worst part of it because they can over clean their skin or overwash their skin, especially with eczema, because that's a skin barrier issue. Eczema being a skin barrier issue, meaning the body cannot hold in the water, right? So you can't like keep washing away and at an already damaged barrier because all you're doing is just keeping your skin dry. And then like not washing the face at all. So you have one end where people are not washing their face and the other end they're doing too much washing. They can oil cleanse too much. They can have unwashed pillowcases or bed sheets that can cause skin inflammation because we're shedding skin cells all the time. When you dust your house, those are trillions of skin cells that have just accumulated over time, like ew, right? But that's what we're seeing. So you have to wash your pillowcases and your sheets. You can overuse acids and pills. You've seen those people on Hollywood and TV when their face is all shiny, it looks like a piece of saran wrap. Yeah, right? It's like placed on their face. Yeah, that's over acids, over peeling. Yeah, their skin is smooth, but is it damaging their skin and damaging their skin barrier? Because our skin is not only a barrier to keep moisture in, it's also our largest detox organ, and it's a barrier to keep bad things out. So when you over peel and over chemical use of acids, you're damaging this protective barrier that you have, right? So not removing makeup properly. I was guilty as charged when I come home from college and we went out and I would come home and I just fall asleep with all my makeup on, wake up with a pimple, wake up with inflamed skin. You have to clean your face. Not washing your body enough. I had to add this because I've seen this happen with people with eczema, because what will happen is some people with eczema, it hurts. The skin hurts when they put water on it. So when they don't wash, it feels better to like not take a shower, but then you can have actually super infections with fungus. And so I've actually seen people with eczema have more itching. And then I'm like, wait a minute, that's not eczema, that's a fungal infection. So then I have to kill the fungus and then treat the eczema. And we have to it's a balance of like not overwashing and not underwashing. Okay. And then, of course, washing your body too much. Talked about that. So hormone balance, hormone imbalance, which is one of the biggest issues with acne, right? Elevated testosterone, history of PCOS or polycystic ovarian syndrome, PMS, premenstrual syndrome, irritability, cyclical acne, when we start seeing that acne that only comes once a month at the same time every month, acne concentrated around the chin and neck area, irregular periods, long periods, heavy periods, no periods, all of that is a signal of hormone imbalance. And when I say irregular periods, long periods, heavy periods, and this is going to blow your mind, but a natural healthy period is somewhere between 3 days long, not too heavy, not too light. And it starts and stops and it ends with no cramps and no headaches and no PMS. And I know people say, wait, that's not possible, but it is, because I do it in my office every day. So we have to start letting people know what a normal period is in the first place, because I think patients don't know. Because I ask them and they say, oh, my period's normal. And I'm like, what's normal? And they're like, oh, it's like 7 to 8 days. I use like these heavy pads, like, 6 a day. I'm like, whoa, no. That's not normal. Common does not mean normal. Common to you, normal for you doesn't mean it's normal. That's just something that's common to you. That's something that you're used to, but that is not normal. And so resetting what normal is for people is a really big part of naturopathic medicine, because we've been taught for a really long time these very broad definitions of normal based on a healthy young white male. And it has not taken into account color and age and sex and history and environment and all of these things that as naturopathic doctors we hone in on. So that's something to keep in mind. History of being on birth control and history of really heavy bleeding with clots, because clots also are not normal. Environmental toxins, breathing in toxin air, exposure to mold, especially it's big here. I'm from San Diego. There's mold in all these houses on the beach. And it's like that beach living. It's like, oh, hashtag like beach life, like Instagrammable homes with mold that is hidden. And so when I have patients where I have been treating them for 4 to 6 months and they're not getting better, I start saying, wait a minute, they should be getting better in like 4 to 6 months. Why aren't you better? Why aren't you better? Mold. History of living in toxic places, chemicals in makeup and hygiene products, so cleaning up the products. History of heavy metal, non-medical chemical exposure, and then unwashed pillowcases and bed sheets, and the allergic triad that is very common in eczema. So these allergic toxins, these environmental toxins, are also a cause of skin disorders. So what is our naturopathic approach? Our naturopathic approach to diseases starts with this, and I know this looks very familiar, courtesy of Dr. Yanez.
Looks familiar to me.
Looks very familiar to you. This is the therapeutic order, and I have used this with permission. I did ask for permission to use this. And if not, let me know that I don't have permission. But the therapeutic order is the 7 philosophical principles of naturopathic medicine. And I live for this. This is like my favorite slide, and I put it in every presentation because this is the foundation of what we do. We establish the foundation for optimal health. So looking at that bottom of the triangle, we're identifying, removing obstacles to cure, and assessing determinants of health. Because that is the one thing, and this is why I love this, because assessing determinants of health is the one common thread that both conventional medicine and naturopathic medicine share. I mean, we do all of these things together in different ways, but the one thing that is common is that we have to assess the determinants of health. So does this person have access to clean water, access to healthy vegetables and food? Does this person have access to healthcare? That is something that we all can get on board with, and it's the foundation of what we do. And so if we remove obstacles to cure, most diseases get better on their own. And I feel like I like tell people to drink water and eat vegetables and poop every day. Like I feel like my job is so easy. But the hard part is once you do that and establish the foundations of health, and then you remove obstacles to cure and they don't get better, that's where the detective comes out. That's where I get my like magnifying glass and my Sherlock Holmes hat out. And then I start treating and figuring out which skin villain is the problem. But when most people, when you identify and remove obstacles to cure, you can find health, because the body has an amazing ability to heal itself if we just give it what it needs and remove obstacles to cure. And then we stimulate self-healing mechanisms. We support weakened systems. We address physical alignment. That's adjustments. I love adjustments because structure dictates function. Then we can do natural symptom control. That's where we use herbs to actually control the symptom. And then after that, if none of that works, then we can use drugs, and then we can do surgery, and then we can send them to. So this is my point of view. Like, I'm going to always go for the lowest hanging fruit and the thing that's the most effective. And the most effective for me is using naturopathic medicine and using drugs and surgery as my last resort, not my first line of treatment, but it's there. And that's that integrative approach that we have as naturopathic doctors. We're not anti-conventional medicine. What we are is we are pro using non-invasive and less harmful techniques first, and then moving on to the higher level interventions as needed. So how do you assess the foundations of health? So this is what I do. First, I talk about sleep. Because if you don't have good sleep, nutrition, bowel function, hydration, exercise, and mental health, you ain't got nothing. I always tell people you can't have clear skin if you don't poop. So if you sit here listening to me right now and you're talking about you poop every other day and you're wondering why you have acne or increased flares of eczema, I'll tell you why, because you're not pooping every day, 2 to 3 times a day, right? So I asked, how many bowel movements do you have? What are you eating? What's your diet like? How are you sleeping? Do you have trouble falling asleep, staying asleep, or waking up? How much water do you drink each day? How are you moving your body? Do you exercise every day? Do you move your body at all? Right? Especially during 2020. Like, this has been the most sedentary time of my life. I was sitting there and I put my hand like this and I felt like I put my shoulder out of place. I was like, oh my gosh, I have no muscle. I have no muscle anymore. I need to get outside. I need to move my body. What is your mental health like? Because I told you that your mental health affects your skin. So what is your mental health like? Are you stressed? And so we assess these. And then I say, okay, how do I treat it? Adequate sleep hygiene, herbs to promote sleep, nutrition, removing food sensitivities and allergies, supplement the diet when necessary, because supplements are to supplement your diet. I am not of the vein of putting people on 20 different supplements, doing 4 pills a day. If I have a patient on more than 5 supplements, more than likely they've talked me into it and I fold it, because you need to do a little bit at a time because you cannot overwhelm the body. Your diet should be the main source of your nutrients. However, we know that our diets are very deficient in nutrients because of the quality of soil that we have, the quality of food that we can get. So we supplement the diet. Bowel function should be optimal between 2 to 3 bowel movements a day with a Bristol stool chart type of 3. If you don't know what it is, Google it. It'll be big fun. Well-formed, sigmoidal in shape, big, large, healthy stools, no blood, no food in stool, right? That's what we're looking for. No straining, proper form when you're on the toilet. We talk about that another day. I feel like I'm a poop doctor most days, right? And the reason why is because the poop tells me what's going on. Like, because we got to know what's going in the body and what's going out the body. And that's how we figure out what's going wrong with the skin. Hydration. You have to drink water to have clear skin. My nieces and nephews just was talking to me because they're starting to get acne and they're 12 and 10. And they're like, Auntie Didi, what are we doing? Like, we're acne and our skin was so much better when we were at Nana's house, my mom. And I was like, because you drink water and eat vegetables over there. And you go home and you got your junk food and all your snacks that your parents let you have. And then you're wondering why your skin gets clear when you go to mom's house, because they're drinking more water and they're eating healthy. And they don't understand that. And so my mission, right, is to let people know. I want to get young people to understanding that these foundations of health, they're the foundations of clear skin, because your skin is just a window to what's going on inside of your body. It's the largest organ and it's the largest detox organ. So your liver detoxes, your kidneys filter, your bowels filter out toxins, and your skin helps when those things aren't functioning. So when your detox organs are not functioning properly, your skin will be the pinch hitter and it will come and try to help the body out. And then it gets irritated and inflamed because of what's going on inside of the body. So when you start looking at skin health, it's not about just putting topicals on. It's about taking the burden of detoxification off the skin, because it's the largest detox organ, but it should not be carrying all the weight of your body. It should not be carrying all of the burden of detoxing your body, because when it does, it gets inflamed. So then we have to optimize the detoxification of the organs of detoxification, such as the liver, kidney, and bowels. Make sense? Okay. I know you guys can't like answer back, but I hope the questions in the chat that you guys are letting me know that you understand. Exercise. All patients must move their body daily, because moving your body with exercise helps to pump the lymphatic system, and the lymphatic system helps to detox our body. And of course, it just keeps us healthy in general, increasing oxygen uptake in our blood and all of those good things you learn about in medical school. And then mental, emotional health. We have to identify areas of stress and decrease them. I refer to psychiatrists, psychologists, counselors, life coaches, religious counselors. I will do and meet the patient where they are, because you have to realize that mental health is still a stigma in most communities. It's not this thing that is like super talked about. So I meet patients where they are. They might think going to a psychiatrist is just out of the question, and they only want to do prayer. So then I can talk to them about going to see their church counselor. And then later, when they're comfortable with that, I can say, you know what, you should get a life coach. And then when they're comfortable with that, I can say, hey, how about a licensed counselor? And then when they're comfortable with that, then I say, you know what, maybe you should get assessed for these things. Because you have to meet patients where they are. And I think doing what is comfortable with the patient and helping them understand their body and what their needs are, and respecting their cultural belief system is so important to health. And to me, that makes a big difference in naturopathic care. That makes a difference in what we do and what other doctors do, because there is no wrong way to do anything. It's just an understanding and meeting patients where they are, and then taking them each level, each step of the way, until you get an understanding, until they get an understanding of what they need. Okay, so here's a case. How are we looking on time, Doc? We good?
We are good. Yes.
Okay, perfect. So I'm doing the case now. So I say 40-ish-year-old female presents to the clinic with a chief complaint of cystic acne. In March, this 40-ish-year-old female comes to me, and she has cystic acne, and it began of January of the current year. And here is the acne. And I do have permission to use these photos, but I blank it out because I still want her to have a semblance of privacy. So do you see these large cysts? She has cysts, she has nodules, she has large comedones. And you can see here, this cyst right here is actually a tract in the middle going down, where I actually, you know, from here to here is all one connected tract, and it's filled with fluid. And they were painful. And she came to my office and she felt like a monster. It was very debilitating for her, and she was in pain, and she didn't know why, because she had never had acne at all in her life. But we had to figure out why. So naturopathic doctors, BFF is a timeline, right? Naturopathic skin doctor. You have to do the history, right? But with skin, it's important to know the first lesion. We have to understand what happened to a T. Like when I say a timeline, I say, tell me, I'm like, let's go back to when you first got eczema. They're like, oh, it just popped up. I said, no, have you ever had a rash like this before? And they're like, yeah, when I was 2. I was like, okay, tell me about when you were 2. What did your mom say? What happened? When did it go away? What did they give you? And then I'll move back up to, okay, now you're 16. What happened? Okay, now you're 30. What happened? So with this patient, they never had any acne before. So, but she did have a history of fibroids, and she was treated with progesterone, and then they discontinued it and then did a hysterectomy. So they removed her uterus in December of the previous year. So it's January is when the skin issue started. They removed her uterus in December, and then she had some small cysts that started on her forehead in January. They gave her doxycycline, adapalene, as a topical, and then they had to discontinue it because she had double overt pain that she could not function, because antibiotics can cause lots of side effects, not only gut dysfunction, because remember, antibiotics is going to kill everything, right? You can have targeted things, but you know, when you think about what an antibiotic does, it's like if you're like trying to, get rid of something. You come in with a machine gun and you spray everything. You kill good and bad bacteria, right? So it's deleting everything in the gut. So she had a small improvement of the forehead cyst in the first week of February. However, the cysts began to appear on the cheeks and the chin and get worse every day. So she had some small improvement and then everything got worse. The second week of February, she started on progesterone and bioidentical creams because she didn't have a uterus. And so they're like, oh no, you don't have a uterus anymore. Your hormones are out of whack. Let's give you some hormones. And then she started like a vegan diet, and she did no soy and no chocolate and no sugar and no alcohol and no coffee. And she still got worse. Within 2 weeks, the right side of her face broke out. Acne lesions appeared on the jawline and the ear. And then it ended up being exactly what you saw before. By March, the lesions had become so large, they were multiplying. And she woke up one morning and her eye was swollen. And then she was started on topical clindamycin. And then she said, I got to see someone. And she found me. So that is the timeline of what happened. So now when you think about this case of like, she tried everything. She actually was seeing a holistic nurse practitioner at the time. So this is somebody that was actually okay with doing the vegan diet and everything. So when patients come to me, they're like, I've tried everything and nothing's working. She's tried everything and nothing's working. And so by the time they make it to me, I'm not seeing just the run of the mill acne. I'm seeing the acne that no one can fix, right? So then the mental health, this is what I was talking about, the mental effects of disease. She has a job speaking in front of corporations. Like this is like, she's dressed in a suit, she's seeing people, and she has these ping pong size, acne on her face. People are staring and pointing to her, and kids are afraid of her. When she goes to the grocery store, little kids are pointing, because little kids don't have no filter. They don't care. They're pointing, they're laughing, they're snickering, they're scared. She no longer goes out in public. She goes to work, she goes home. She has no quality of life, zero quality of life. So another thing that I hear with treating skin disease is that I cry in the shower. I don't have a life. I stay home because I don't know when to see me. I feel like a monster. I look like a monster. I'm ugly. I don't know if my husband loves me anymore. I don't want him to leave me. Patients are truly affected by this. This is not just, when people say, oh, you do skin, they think I'm like doing like Botox and vampire facials all day long. No, what I'm doing is I'm helping people get their life back. I'm helping them find the superhero that's inside of them because they have lost their hope. They have lost their faith. They don't believe anyone can help them, and they are sad and they are defeated. And I help them find out that they're more than their skin. And so my practice is not just aesthetics, it is helping people discover and find themselves again. And once again, that chronic stress that they have elevates cortisol, increasing the severity of chronic diseases, and can lead to depression, anxiety, and social isolation. And most of the patients that come to see me, if not one of those, have all three. So, Vis Medicatrix Naturae, if you tune in to all of these webinars that the AANC does, you will have heard about the Vis. And the Vis is what we call it for short, and that is the healing power of nature. And so when we treat naturopathically skin conditions, once again, removing obstacles to cure, we allow the body to heal itself, and we use the healing power of nature. And this is how we do it. Rule number one, optimize digestion. Heal the gut. We call that gut healing. It all starts with the gut. And I say heal the gut because if you cannot absorb nutrients and if you cannot get rid of toxins, you cannot absorb nutrients properly. You cannot absorb nutrients properly that your skin needs. So you have to heal the gut. You have to optimize digestion. So I start there. The reason why you're taking all of these supplements and nothing's working is because you're not absorbing them. So if you cannot absorb supplements, why would I give you a handful of skin nutrients and why would you take a Nutrafol for to grow hair when you don't poop? You can't absorb it. What are you taking that hair, skin, and nail gummy vitamin? You're not absorbing that. What are you doing? So it doesn't mean none of that stuff is working, because people always say supplements don't work. Supplements don't work. It's not the supplements don't work. Your gut don't work. You got to fix your gut and then the supplements will work. So one of the quickest, easiest ways to start helping your gut health is to take a probiotic daily. And you should take a probiotic with billions of bacteria, anywhere between 10 billion of bacteria to 40 billion of bacteria, CFUs, colony forming units of probiotics. Now, once again, I'm a doctor, but not your doctor. So you have to see what strains you need. And if you need a broad strain or just one specific, that's what naturopathic doctors do. They figure out what you need. But probiotics are the easiest way to get good bacteria in there to harmonize the gut flora. And that's the environment. And this is one of the things of gut. Stop blaming gluten and dairy for everything. I get so mad when people are like, it's gluten, it's dairy. Test for food intolerances. Do you know how many people I've treated for acne, eczema, and psoriasis that all have like a banana sensitivity, and they put a banana in their smoothie every day? And then we take the banana out and it never was bred, and they're wondering why they're gluten-free and dairy-free and their skin isn't better. Like that's naturopathic medicine. We can't blame gluten and dairy for everything. You have to test for food sensitivities and food intolerances. And food intolerance or sensitivity is when you have an IgG reaction, which manifests as more like leaky gut and chronic inflammation, versus the IgE, which is where your throat swells up and your eyes swell up and you can't like breathe. Those things kill you. These things just make you IgG. It kind of just makes you feel It can make you feel meh, and you can be tired, and you can have a flare of your chronic disease. So don't blame gluten dairy. But I mean, to be honest, most of the time it is gluten dairy. So I like redacted statement. Like, I just don't want you to only blame gluten and dairy and then say, when I take out gluten and dairy, nothing's better. It can't, like, naturopathic medicine doesn't work. No, you just have to figure out what is your food sensitivity. Because I will say this, the major food sensitivity in psoriasis is eggs. And that's eggs in everything. But I've also seen a patient with psoriasis who had a sensitivity to almonds and was drinking almond milk every day because they thought it was dairy. And they took out the dairy, and they had wondered why, when they got healthy, their psoriasis got worse. Well, they had a sensitivity to almonds, and they were drinking almond milk every day instead of dairy. And so, I mean, I hate to say this, but I was just like, you can actually do dairy, but that almond, gotta nix it for at least a couple of weeks when I heal up your gut. Right? And so you stop reacting like this to almonds, because we don't take away food sensitivities forever. We take them away until we heal the gut, because the food sensitivity is not forever. It is, you are in an allergic state where your body cannot tolerate the food. It's intolerant of the food. We heal the gut, the body no longer reacts to it, and then you can have your almond milk back. And, side note, one of the major things that we find in acne is not, gluten and dairy, it's sugar, because sugar is inflammatory. So you got to watch your sugar. And eczema, it could be anything. I've seen eczema flare with bananas and almonds and eggs and kimchi, because it releases histamine. Kimchi is any type of canned food or pickled food releases histamine. So even healthy foods that are pickled can actually cause your eczema to flare. So these are things that the little things that we pick up on in naturopathic medicine that's completely different from the conventional treatment of skin disease. Rule number 2, reduce systemic inflammation. Omega-3 fatty acids are the major way to do that. That's commonly seen in fish oil, but you can also get it in nuts and seeds and algae for those that are vegan or choose to be vegan. I do not promote a specific diet. I do diets that are based off the patient's constitution and what they are sensitive to. But if you choose to do vegan, once again, meeting the patient where they are, it's not my job to tell you it's wrong. It's my job to keep you healthy while you're doing it. So if you want to choose to be vegan, then we have to make sure you have vegan omega-3s, which you can get from algae oils and nuts and seeds. That's going to reduce that systemic inflammation, and that is causing the inflammation. So you think about acne and eczema and psoriasis, these are all inflammatory skin disorders. So we have to heal the gut so you can absorb the nutrients. We have to reduce the inflammation, and that's what's going to get rid of that redness and that inflammation in those lesions. With acne, that will decrease those cysts. With eczema, it will decrease the itching. With psoriasis, it's going to flatten those plaques, right? So looking at omega-3 fatty acids are number one thing. Reducing local inflammation. So this is where we get into the non-toxic topicals, right? We have to actually put some things on top. Clear local infection if present. Remember when I was saying the eczema patient that didn't take a bath and then they had the fungal infection, I had to clear the fungal infection. Then we heal the eczema skin barrier issues. So you need to use topicals that are non-inflammatory. Here's a key pro tip. When you're using food-based topicals, make sure you don't have a food sensitivity to those food-based topicals. Because a lot of things that people do is like they will say, oh my gosh, let me put on this topical because it's all natural and it has like papaya enzymes in it, and they have a papaya allergy or sensitivity, and it makes their skin worse. And they're like, oh man, this natural product doesn't work. And I'm like, is it that a natural product doesn't work? Or is it that you're just sensitive to the product because you didn't individualize the treatment? So you want to look at non-toxic topicals to reduce inflammation. Something very simple for acne is like a niacin cream that I would normally compound for my patient. And this patient, that's what I did. Eczema, we use different types of topicals, but indigo is really great herbal topical for healing eczema and psoriasis. And then we look at things like vitamin D creams and vitamin E creams. So those are very helpful, not only with healing, but in decreasing inflammation, but also dealing with the scarring. Heal the skin and reduce scarring. I kind of jumped into the other one. So not only is that good for the topicals, but that's when you do a skin multivitamin. And I talk about this order of operations because this is the way I do it. Like you can't just put them on a skin multivitamin and think, oh, it's gonna fix everything. You have to heal the gut. You have to decrease inflammation systemically. You have to make sure you're using topicals and do topical treatments too. And then you're gonna put on a skin multivitamin and any type of healing things that you need. Because if you cannot absorb, it doesn't matter. And if you don't have the nutrients to make healthy skin, it won't help. So you have to put those nutrients in. So for 6 months, the treatment for the young lady that you saw was weekly injections into the cyst with a homeopathic injectable. Now that injectable is no longer available. And I only did those in cysts, but now I've learned to use without it, right? This was like my very first case of really awful cystic acne. So I was injecting the homeopathic injectable there, and it helped tremendously with decreasing that pain. We did a special compounded niacinamide cream. We did vitamin A internally. Remember, skin nutrients, the skin needs vitamin A. We did fish oils. We did a probiotic. We did diet changes. The patient wanted to do vegan. I looked at her food sensitivity panel, and all that popped on there was sugar, gluten, soy, and chocolate. Those are the only things I took away, and I only took those away for 4 weeks. She self-imposed it for 6 months, but I told her 4 weeks is enough. And then we did healing herbs. I also did an herbal tincture that was specifically formulated for the patient. Now, in most naturopathic schools, we have medicinaries. In those medicinaries, we have formulations where we can, as a doctor, put herbs together in combination for the patient. So with that patient, I used a lymphagogue, meaning a herb that drained lymphatics, an herb that was antimicrobial, an herb that was anti-inflammatory, and 2 herbs that were hormone balancing. I wrote it on a prescription pad, and a natural medicinary at SCNM mixed it together for me, and the patient had a prescription of an herbal combination. And that is what she used daily. And she did this for 6 months. And that's what we got. There were no antibiotics used. There were no steroids used. And she had completely clear skin in 6 months with that treatment. And so this was my very first case. And this is what made me decide that this is the only thing I want to do. Because the change in her life, when she said, you helped me get my life back. She spoke at my book release party. She has been an integral part of my life and sharing her testimony with other people. And it has changed my practice to a focus of skin, because that's when I knew that naturopathic medicine was all that I needed. Because we don't need drugs and we don't need steroids to fix anything. We have them as our last resort, but we don't need them in our first line of treatment. This is diet, this is lifestyle, this is removing obstacles to cure, giving the body what it needs and allowing it to do what it does, which is heal itself. And to me, that is what naturopathic medicine is. So what I love about it is being a naturopathic doctor means I get to help people when everyone else has told them that there is no hope. They don't have any answers for them, but we have all these tools in our tool belt. And being a naturopathic doctor means that I can help people that are helpless and without hope. I know that I can't fix everyone. So the reason why I specialize in skin is that I can't fix everyone, but I know acne and I know skin rashes. And I'm confident that I can fix anyone that walks into my door. And I feel pretty awesome about that. And the reason why is because it's not that every naturopathic doctor can't treat skin rashes. When you become a naturopathic doctor, you'll be able to treat any disease. What happens when you start to specialize and focus in a specific disease is that you start to see patterns and you start to see a recipe, right? You start to see everybody's individual, but there's certain things that everyone needs, but how you deliver that to them is what's individualized. But you see the pattern and then you can do it faster than other people. There are other people that can clear skin diseases, but it takes like 2 years. And then they tell them, oh, it's going to get worse before it gets better. And it's going to take about 2 or 3 years before you find cure. And I'm like, no, it's like 4 to 6 months when you're with somebody that knows what they're doing because they've seen it before. And not because they're better than any other doctor. It's because I've seen it before. And I've been doing this for 12 years. And when an acne patient walks into my door and I ask them what's going on and how can I help you, they start to all have the same story. And then I figure out which big baddie or skin villain that's the problem. And I take one at a time. And I say, okay, well, this skin villain is your major problem. Let's do this one first, because that's where you're going to see the most effect. And then we're going to work on the other ones. And I just give them a very realistic timeline. And that's what you get when you've been doing it a long time. Looking forward, my future plans, skin and hair education. I want to take everything that I do and put it online. So my superheroskincare.com is where I will have a hub for all things skin, because I want skin and hair education because everybody can't afford naturopathic medicine. And I'm acutely aware of the inequality of healthcare in this beautiful nation that we live in, but how a lot of people do not have access to health and healthcare, and definitely not naturopathic healthcare. So I want to be able to create an online hub for patients and anyone who has skin diseases to be able to treat themselves at home with the help of my online programs, supplements, and skincare products. And we're in the process of creating all of that now. So if you want to know more about it, just get on our waiting list for that information and sign up for our newsletter. Advice or pearls for prospective students, I would just like to say, if you are interested in being a naturopathic doctor and you know in your very being that this is all that you want to do, know who you are, because it's a hard road. We are not the most accepted doctors in the world. So you will come against things that will tell you every day that you don't belong in this space, that you are not necessarily good enough, that what you're doing, although the people want it, that not necessarily all your colleagues will feel that way. And you have to know who you are and be strong in that. Because when people told me that, naturopathic medicine wasn't real, or it was a quackery, or because this was like in 2002, so we only had 7 schools, right? And I know the people before me even dealt with worse. And so when people came to me and were like, why are you leaving? Why didn't you just become a DO? Why didn't you just finish your degree so you could have, better money or this lifestyle? I was like, I can have money in naturopathic medicine. I can have a great lifestyle in naturopathic medicine. And more than anything, I can change the world. And you have to believe that in your heart. And you have to understand how you learn. And on the student part of that is because the way doctors teach is like usually a PowerPoint, and it might be a boring lecture, and you can't do anything about that in school. So don't complain, figure out what you need to do so that you can excel. I figured out that I was a very visual learner. So I had to take all of my notes and like make pictures out of them, right? And so that is what I did. And so I had to figure that out. And I didn't figure that out in DO school. I figured that out after. And I figured that at naturopathic school. And I went from being a C, D student, failing student, to being a straight A student with the same concepts. And it wasn't because naturopathic school was easier. It was way harder because we had regular medical school stuff. Then we had botanical medicine, homeopathy, acupuncture, all added on. So it was actually more classes. I was in class from 8 a.m. to 10 p.m. every day. And so it's not easier. So don't think, oh, I'm gonna go to naturopathic school because it's an easier route. It's not an easier route. You have to learn more stuff, but you have to know how you study. And once I figured out how I study, I aced everything, because people of color, women, and people with English as a second language all have different learning skills, and they are more likely to fail boards because of their learning skills being different. So there are people of color and people that are women and people that have English as a second language that are failing out of medical school because they don't know how they study. And it has nothing to do with intellect. So understanding how you study, and this is a passion of mine, having been a professor, understanding how you study and knowing, I don't care if you have to go to an educational psychologist, take all the tests that online, figure out what you need to do to get information in your mind first, and then go to school and rock it and know who you are. Because if you want to be a naturopath, we need you, because we are only as strong as our next entering class. And so I would love to have you join me as a colleague. And if this is something that you're ready to do, please continue to hang out with the AANMC and watch all the videos and learn about naturopathic medicine. So that's it. My take-home points. Although each skin disease may present the same, the causes vary from person to person. And it says my job as a naturopathic doctor to figure out what skin villain is causing your problem. The key to treating any skin disease is discovering that skin villain and fixing the problem. And if you heal the gut, remove obstacles to cure, the body will display its amazing ability to heal itself as soon as we get out of its way. Thank you so much for having me. Here's some references for you. And then here's my contact information. So if you guys want to get in touch with me, you can find me at Nourish Medical Center Seeing Patients. You can sign up for a 15-minute free consult at the number below, but check me out on Instagram and keep up with me, and I'll keep you abreast on what we're doing with superhero skincare. Thank you so much for your time.
Thank you so much, Dr. Sims. If you can just go to the next slide real quickly before we get to a few questions. So we do have, as Dr. Sims mentioned, free monthly webinars. So next month is with Dr. Fraser Smith of NUHS and AANMC's past president, speaking on healthy aging. And then we will continue on that. We'll have a virtual fair in November and lots more webinars coming this way. So please stay tuned. Dr. Sims, I know we just have like 2 minutes and there are several questions that are here.
I'm sorry.
That's okay. That's okay. So there was a question about how you got into your specialization. And oftentimes we hear from students like, how do I specialize, or how do I find out what I'm good at? Can you just speak briefly to that?
Oh, and I mentioned that before. So basically I ended up doing skincare I ended up doing skincare because I was at a drug rehab and I saw the skin getting better, but I didn't specialize in skin. When I came out, my specialty was acupuncture, IVs, and pain management because I wanted to be like a sports doctor. So I did adjustments because I came from osteopathic school. So I'm really good at adjustments. I did adjustments, I did IV therapy, I did pain management and acupuncture, and I saw people with joint pains and problems. And then I learned PRP injections for joints, but I also learned it for skin. So I started doing that. And then I ended up seeing this happen, having the case that you just saw. And I was like, oh, this is what I want to do. And that was like almost like 5 years in. So I wasn't necessarily focused on skin until that case. And then I said, you know what? And then people started sending me skin. And then that's how it started. It wasn't like a conscious decision. I was good at it. People saw the case. And then we did a spread on it, a video on it. It kind of took a world on its own. And then patients started coming to me after seeing the testimony. And then I just became a skin doctor. That was it.
Thank you. So, I think there are a lot of questions, and unfortunately, we're not going to be able to get to them today in the course of our time. So I apologize to you all. But Dr. Sims did provide her social media. If you can just go back to the social media page real quickly.
I'm gonna go back to this social media page. You guys hit me up on Instagram. Go to Superhero Skincare, sign up for the waiting list for my program so you can get on the newsletter. But go and follow me on Instagram and then send me a message. And then I can answer it on Instagram in the question. So make sure you remember your question, write it down, go to Instagram right now, send it to me so I can make some reels with the answers.
And also, as Dr. Sims mentioned, she is a doctor, not necessarily your doctor. So we really do encourage people. And I see some questions coming in that are personal and about your own personal health. So I definitely encourage you, if you are having personal skin issues, to connect with a doctor, a naturopathic doctor or a doctor, depending on what the issues are, and make sure that you're getting the best treatment plan. A free 1-hour webinar necessarily is not the best place to get medical advice for yourself. So, just want to make sure that you also are getting the best care. And so you can find NDs near you through the American Association of Naturopathic Physicians, the Canadian Association of Naturopathic Physicians, and state associations, as well as specialty associations. So there are many different ways of finding NDs near you, but I definitely encourage you to reach out to naturopathic doctors like Dr. Sims if you're having some health concerns, to make sure that you get the best care and the best treatment for yourself. So with that, thank you, Dr. Sims. This was an incredible session. I loved your energy. I loved what you brought to the table here. And I'm so thankful for you sharing your knowledge and expertise with our folks today. And if you do have continuing questions about becoming a naturopathic student or anything regarding the profession and career, please feel free to email us at info@aanmc.org and we can get you taken care of. So with that, I'm going to close today. And thank you so much, Dr. Sims. Take care.
Thank you so much. Bye.